Welcome back to Recharge. Dr. Gene here with
Dr. Ryan Smith.
Let's talk about discs.
Which is probably a scary phrase for most people, right? Like, I'm gonna hurt my disc, I'm gonna bend over just right or just wrong, and my disc is gonna shoot out my back. Gets a lot of bad hype. A lot of potential fear is out there about disc herniation. So let's set the narrative straight and kind of give you everything from what is a disc herniation, what are the types, and to what am I gonna feel or not feel, and who does and does not have them.
Yeah, so this is all about discs. Let's get into it. All right, we have so many conversations about people's discs. I mean, you would think that these discs are the end all and be all for any pain that happens in the body, and probably for justified reason, because when you usually see a medical professional, physical therapist, chiropractor, physician, orthopedist, one of the first things that they will look at is your discs through imaging, such as MRIs. Well, we know now, though, that MRI doesn't really paint the full, dynamic, accurate picture.
That's right. Oftentimes what we're seeing now is people who have pain or are going in for low back pain or any type of pain will have similar imaging to those who are not having pain. So we'll list those as symptomatic, those with pain, and asymptomatic, those without. And we can divide those people up, look at imaging for both, and relatively speaking, they're very similar. And we know that people have disc herniations or disc bulges or degenerative disc disease gradually throughout their entire life, whether they have pain or not, and usually it increases as we get older. So pain does not dictate what our imaging looks like, and imaging does not dictate what our pain is.
Yeah, there's studies that show that most people can have a disc herniation in their 20s, their 30s, and not even know it. In fact, there are studies that show up to 80% of people have disc herniations that are completely asymptomatic, meaning have no symptoms, no pain, no issues at all. They just have them. Just because you have a disc herniation doesn't mean you will have pain. Speaking of disc herniations, you throw a lot of words at people. There's different types of disc herniations. It goes from a little protrusion to prolapse. The worst one is called a sequestration, when the disc kind of leaks out. That's the worst case scenario, and that's usually the least common one. Let's talk about some symptoms that happen through each one of these disc herniations, from the most mild.
So from the most mild, you can have potentially no symptoms at all, realistically. You might just be
like we've been saying.
Yeah. You could potentially have just a slight twinge in the lower back with no symptoms other than just feel kind of stiff, or it's kind of a pokey, sharp pain in that general area. Or the most severe version of that can be where the disc is actually pushing out and protruding on the actual nerve. And in that case, you may have potentially a loss of sensation all the way down your leg, a loss of muscle function or reflexes, which we would call neurological signs. Now that is probably more rare than what we typically see, but that is a potential deficit from having a disc issue. And that's what most people are worried about. If I have a disc issue, I'm gonna lose sensation and the use of my leg. Realistically, that is a very rare scenario, and is often with acute trauma rather than long-term back pain.
So in other words, most people are typically worried about the worst case scenario, when in reality, that is a tiny, tiny fraction of most cases. Usually, it's just a normal process of getting older or being active, is to have this breaking down of discs without any significant issues. So if you do feel symptoms, we have a certain process to figure out how bad is it. First of all, when a disc herniation initially happens, this is called an acute issue, meaning it just happened. You're gonna feel probably the most pain in that phase because your body goes through an inflammatory process. This happens whether you have a disc herniation, this happens whether you scratch yourself, it doesn't matter. Whether you sprain your ankle, this is usually the most common thing, right? Think about if you sprain your ankle, when it first happens, it hurts a little bit, but then later in the day, it starts to swell up. This swelling is normal. It's your body's way of processing and healing. Same thing happens in the back. When you have that initial disc herniation, imagine your ankle, how it puffs up, same thing happens in the back. The thing is, there's not enough space or as much space in the back because you have your spinal cord and you have everything tightly wound up as in the ankle. So this little inflammation, this expansion of space pushes on nerves, pushes on ligaments, pushes on things that your brain goes, whoa, 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 whoa. And then you feel this pain. And people really freak out in this initial stage. But the best thing you can do is calm down, go for a walk if possible. But the best thing is just wait. Let time do its thing. Inflammatory process lasts anywhere from 3 to 7 days, could last up to 2 weeks, depending on your body and your kind of immune system and your processes. And then after that, you'll have a much more accurate picture of how to process this pain. Now, you can still do things in that inflammatory stage, like see a physical therapist, right?
And one of the big things we do, more so than anything, is give reassurance, right? We're going to look through any of those potential neurological signs you mentioned earlier of, is this a bigger issue than we think? If not, we can help to show you ways to keep moving that doesn't constantly push into pain, that allows you to keep moving and gives you reassurance and confidence that you can keep moving. And that's our biggest goal in that first visit. Rule out anything sinister, show you that you can be confident and keep moving, and give you ways to do so, knowing that the natural history and the course of the injury and the disc injury itself is going to more than likely heal itself and you'll be just fine.
Yeah, and after the disc, even if your pain is because of the disc herniation, after your disc herniation heals up, you can still have pain. This happens all the time because usually a healing process is, even in worst case scenario, can last 6 to 8 weeks, like a broken bone. Disc herniations can vary, but let's say in that time frame you heal up, but you can still have pain because if you're constantly afraid, if you're afraid to move, if you feel like you're gonna injure yourself even more, your brain changes how you perceive anything that is potentially dangerous, and it becomes pain. So one of the best things you can do, and we help with this, is guide through the process like Ryan said. Make sure that you know and your nervous system knows and your brain knows that movement is okay, that it's okay to exercise again, it's okay to run again, it's okay to do these things that help you actually be a human being and live. So it's one of the biggest things to move past this idea that your disc herniation is controlling everything, is the cause of everything pain related, because that's just not the case. And if you feel like you have a disc herniation, and if it's not going away, if your pain is constantly bugging you in your low back, especially if you feel numbness and tingling, very bad shooting pains, if you feel like you don't have control over your leg, or you have changes in bowel and bladder symptoms, these are more serious symptoms that you should get addressed by your healthcare professional, physical therapist, your primary care physician, something along those lines, and then get that taken care of and start moving.